Nepal has been dealing with skyrocketing COVID cases every day this week. Hospitals are running low on life-saving supplies, prompting the government to ask for empty oxygen cylinders left behind by climbers on Mt Everest for emergency use.
After cancelling last year's climbing season as a result of the pandemic, the government of Nepal announced earlier this year it was open for business. More than 400 permits were issued, a record number. And at $11,000 a permit, a welcome windfall of more than $4 million for the government of this impoverished nation. But as more than 1,000 climbers, Sherpas and staff began arriving at base camp, word was spreading of India's second wave surging across the border into Nepal. And suddenly there was an outbreak of COVID cases on the mountain.
Many people sick, a lot of people that they're from one day to the other day, they disappearing and nobody says nothing.
The government maintains there have been no COVID cases at Mt Everest, despite the evacuation of dozens of climbers to hospitals in Kathmandu who have then tested positive. There is still no COVID testing facility at base camp.
The government were trying to keep the COVID cases under the carpet. And I'm afraid the worst case scenario has become true.
The chairman of the biggest tour company on Everest told us earlier this week more than 30 of their Everest clients tested positive. The company on Thursday announced 2 climbers, a US and Swiss national, had died Wednesday during their Everest attempt. The first deaths of the season. Usually there are about 10 deaths a year. Exhaustion is being blamed. Officials won't confirm if the bodies will be tested for COVID. While climbers chase their Everest dreams, an oxygen crisis is unfolding across the country, with hospitals running out as the second wave devastates Nepal. The government is calling on climbers to return used oxygen cylinders to help COVID patients. But it's a drop in the ocean, considering the scale of this calamity.